Hello and welcome. This DVD has been produced by British Waterways for all its employees so that we can take a close look at all the lessons that need to be learned from some of the major incidents that have occurred over the past few years. We'll be talking to some key employees, and from their experiences we'll learn what we could do differently in order to create a safer working environment for everybody. Now, I'm joined today by Tony Stammers, who's Head of Health and Safety. Tony, hi.
Hello, Richard.
Tell me, what are your thoughts on BW's health and safety record over the past 5 years?
Well, Richard, British Waterways has done pretty well in health and safety performance over the past 5 years, but over recent years we've hit something of a performance plateau, and it's that we need to address in this programme.
What needs to change?
Well, what needs to change is the way we execute work. Our guys on the front line are our last line of defence, and without the support of managers and supervisors and engineers, they're put at risk. We need to plan work properly, we need to assess risks, and we need to do that comprehensively and thoroughly.
Okay, and what's changed already?
Well, one of the key things that we've changed is having a revision to our manager's site audit process, which focuses not only on what the guys are doing in the front line, but also, quite crucially, it focuses on what the managers do in terms of setting the site ups, in terms of assessing risks, and in terms of making sure the guys in the front line are protected.
Okay, let's talk about behaviour for a minute. What needs to change in terms of employees' behaviour?
Well, if you look at some of the incidents that we'll see in the film, it's plain that we have in the past relied on custom and practice. We've done things the way we've always done them. We haven't critically looked at the risks, we haven't critically looked at the control measures we need to put in place.
Okay, so is there a key message, would you say?
Well, I think a key message for the workforce is you have a point of work risk assessment process. You must use that. If you're unsure or uncomfortable about the things you're about to do, don't do them. But when we are working, what we must do, if we see somebody putting themselves at risk or we're uncomfortable with a work situation, then we must step in. We must say something. My message is don't walk by.
Oh, don't walk by. Tony, thank you very much indeed. Thank you.
We had a diving team on site all week fitting a new dam at Upperload Lock on the River Severn.
Dam's in and damn well better work.
Yeah, well, damn well better work before we get back tonight.
Yeah, it shouldn't take too long. It's been all right already.
Yeah.
They arrived on Monday and the job went very well. By Thursday evening the dam was in place. They still needed to check whether there were any leaks to the dam, so the lock was drained on Thursday evening, and they returned on Friday morning to check how successful their work had been.
Yep, still leaking. Yeah.
Well, it was at the end of the week, and we needed to arrive early in the morning to check the lock to see that it wasn't leaking. Unfortunately, it was leaking a lot more than we'd anticipated, so we know we needed to do something about it, we needed to sort it out, so we went about fixing it.
We no longer employ divers, we use specialist contractors. So we had no expertise on site to judge whether there was any risk with the diver going back into the water on Friday morning. But of course, there was.
And realised that the diver was actually stuck down on the bottom. A load of us grabbed hold of the umbilical cord and tried to pull him out, but he was stuck there. There was no way we could move him.
We were told to go down there and try and assist to try and get the diver from the bottom, which we tried, but we couldn't do because there were two different levels of water.
There was a knock at the door, and two police officers were just standing there. One of them told me it was about my son.
There was 4 of us pulling, and we were pulling as hard as we could, and there was just nothing we could do. He was just stuck there, and lots of people just running around trying to think of things to do and trying to find a way of getting him out, and there was nothing we could do. He was just trapped. He was my mate.
There was massive water pressure on the young man, caused by a difference in water level across the lock gates. About a metre in height difference in level caused huge pressure on the young man at the bottom of the lock. If the water levels had been equal, there'd have been no pressure, no incident, the man would have been perfectly safe. With the pressure, the massive pressure, nobody could have pulled him out.
I'd lost my son. Nothing was going to bring him back. No one else should die. Lessons have to be learnt from this.
I mean, we're working on the river all the time, and though it was quite a few years ago, every time that you come through the lock or you work by the lock, you always just glance over there and just memories of what happened on that day, and kind of never goes away, really.
It was the run up to Christmas. It's a day I'll never forget. We've been working on a lock stoppage for 3 months, installing new gates. All what was left to do was to clear the site. We had a tool store, and it was the very last thing we had to clear. And we sledged it up to a lifting point where we were going to lift it and take it away with a lorry, and then that's when my accident happened. I remember going towards just to take the chain off the machine, and just bending down to take the hook off, and then I was struck by, I didn't know what at the time, but I just felt an impact blow onto my chest. I took a deep breath and remember saying to the colleagues, I'll be all right in a minute. But then I felt faint and collapsed to the ground, and lay there. The lads protected my head and wanted minimal first aid until the emergency services arrived. And then I was taken away to Leighton Hospital, where I spent 4 days in intensive care. I knew it was Christmas Day and my son was coming to visit in the afternoon, but I always remember talking to the nurses and asking them to give me as much medication as I could so I could be sat up in bed to welcome him when he arrived. The haunting, I can always remember his face when he walked in, to see all his dad all wired up into different monitors and tubes and everything, and the look on his face I shall always remember. It's just the fear factor. It brought it home that life was so precious. I was 1 ounce away from death, and if I was put in the situation again, I would have clear communications between operators, banksmen, people around in the area, members of the public. Just be aware that anything can happen. My life changed in a split second. I'll never forget that. I was at work, happy, clearing site before Christmas 1 minute, and I was lying in intensive care the next.
We've got a system in place now called the POWER, Point of Work Risk Assessment, that allows jobs to be stopped for the right reasons. If you feel that you're in danger or working unsafely, or there's a better method, that you can always ring a no and then contact the supervisor or your line manager to actually discuss a better way of doing that job. I think there's a huge culture change got to go on through the company, and I think what the lads need to understand is that nobody's expecting them to work unsafely. We aren't an emergency organisation. We do, in fact, we do have times to run jobs, but it wouldn't be the end of the world if a job ran over, as long as we were doing it safely. Look out for each other, take a step backwards, consider all the options, be involved in the planning side of each operation. A major boost for me would be to see all the staff go home safely, to not cut corners, to not walk by any unsafe acts, and to help their fellow employees to work safer.
Neil was doing all he could to demobilise the site after a stoppage, but there was 6 inches of water in the hopper, so this was proving to be very difficult. The hopper rolled as the water moved to one side, and Neil was hit by an unsecured lock gate and became trapped between the 1-ton gate and the side of the hopper. Miraculously, Neil escaped injury. Kevin was helping to dismantle a lock gate during a stoppage. The balance beam, when it was cut from the gate, swung on the crane hoist and hit Kevin, breaking a couple of bones in his left leg. This incident meant Kevin had to have extensive surgery and take almost 5 months off work. As you can imagine, this had a major impact on both his home and his work life.
So we've seen what can happen when things go wrong. And what have we learnt? Managers and supervisors, 3 key things. Think about the job. Plan the job properly. And most importantly of all, check the understanding of people. They must know what you expect from them. For Canal Bank colleagues, the last line of defence. We just want you to stop and think before you act. There are good processes in place to make your workplace safe. Use the point of work risk assessment. It's your chance to stop the job if you think there's anything unsafe. And near miss reporting. This is our chance to get a free lesson. So let's take advantage of that simple system. Now we're all in this together. We can make a difference. We can improve safety in BW, and we can make BW a safer place to work. Thank you.